When you have 15 people, and the 15 within a couple of days is going to be down to close to zero. 6 weeks ago, 8 weeks ago, you never heard of this. All of a sudden, it's got the world aflutter. We will be suspending all travel from Europe to the United States. I am officially declaring a national emergency.
On March 11th, the World Health Organization declared coronavirus a pandemic.
We have rang the alarm bell loud and clear.
January 21st was the date the first case of the virus was reported in the United States. As America scrambles to understand the scope of this crisis, the number of cases are escalating each day, and there are many ways this outbreak is affecting the US. Fear has caused the US stock market to have its worst week since Black Monday in 1987. And with the outbreak driving down the demand for oil, it's triggered a price war.
We saw this standoff between Russia and Saudi Arabia, and then Saudi Arabia slashed oil prices.
That means gas prices are dropping at the pump. President Trump announced a tax deadline extension to help lessen the economic effects of the outbreak.
Without interest or penalties for certain individuals and businesses negatively impacted.
The administration will also provide $50 billion low-interest loans to affected businesses. Two measures health officials have urged people to practice are social distancing and self-quarantine. But what's the difference? Social distancing involves staying away from other people in order to avoid catching or spreading a virus. Self-quarantine, on the other hand, means separating and restricting the movement of those who are not yet sick but have been exposed to the disease. These efforts will help flatten the curve. In other words, reduce the number of people with coronavirus and keep the healthcare system from becoming even more overwhelmed.
The system is not really geared to what we need right now.
Which leads us to testing. The testing system for coronavirus in the US is currently not so great. Government officials gave confusing and conflicting answers about how many tests would be available and when. But lawmakers say, as of March 12th, less than 10,000 Americans have been tested.
I think a lot of people, like myself, are concerned that we don't have the level of testing that you're seeing in other countries.
It could be a combination of factors that are delaying testing. The CDC developed its own coronavirus test instead of using one approved by the WHO. But there were problems with that initial CDC test and with the supply chain for the kits.
This legislation facilitates free coronavirus testing for everyone who needs a test, including the uninsured.
As the outbreak spreads, the numbers that the government shares is our only understanding of what dangers coronavirus poses to people. For now, this is the closest picture we have to gauge of what to expect next.